Emergency medicine saves lives. Most life-threatening events can be treated effectively if the patient can receive appropriate care quickly. But what if you're not near a large hospital and you're critically ill?
We are in a rural setting, and at times we are challenged with bodies and the resources.
What's critically important is that those persons with those limited hands know how to use that equipment in an effective and efficient way.
Use what you have, use it effectively, and work as a team. Stabilize the patient and get them to a higher level of care. More than 20 years ago, a group of Minnesota healthcare professionals came together to seek a solution.
We started not in strength but feeling of weakness, but the need to improve, the need to do something. And then from there, the history of CALS evolves.
So we had physicians, PAs, nurse practitioners, nurses, paramedics, and everybody came together to help start developing the curriculum and look and see what could this course look like. And that's where it all started.
In 1996, the CALS program began. Comprehensive Advanced Life Support. Train doctors, nurses, and other professionals in the rural corners of the United States to use the knowledge and resources they already have and use them effectively.
So CALS does prepare us as a team in rural facilities to do just that, to do the important things during that first hour that are going to make a difference for that patient.
And we have kind of a diamond that we talk about, and so we say that the 4 things that are needed for effective patient care is you have to have people that have the knowledge of what they're supposed to do and how they treat the illnesses or the injury that occurs.
All 4 elements work together to create a systematic approach that leads to excellent patient care in the emergent setting.
CALS is as the name says, it's comprehensive. It basically covers the full scope of more common emergencies and life-threatening emergencies that you can see in practice. And it allows you to develop the skills to deal with those emergencies if they by chance come up.
That's what I kind of like about CALS, because it does have that step-by-step walking you through it. What do you need to think about when that patient is coming in, even before the ambulance come in?
We repeatedly hear comments from all of our staff, nurses, physicians, ambulance attendants, and so forth, that this is so much better. We have so much more confidence.
In a time of financial strain within the healthcare system, CALS training is a solid investment in better patient results.
I do believe that CALS is a very good investment, and I think it really impacts the patient outcomes in a rural setting.
Professionals are coming into our facility who know how to provide that training. We don't need to send those professionals outside to be able to receive that training.
CALS has expanded from Minnesota into Wisconsin and Montana, and even overseas. But the opportunity to save lives using this proven program is really just beginning.
Well, I think the ultimate goal is that, every person has access to good critical care, regardless of where they live in the world. And whether you live in a farm in rural Minnesota or you live in a farm in rural Tanzania, that when you come to your healthcare facility, you get good care.
I think a CALS program similar to the one in Minnesota should be active in every state. I think that would be just great. I think that the quality of care in rural hospitals would increase across the board, and the level of satisfaction and confidence that rural providers have would just go through the roof.
Comprehensive Advanced Life Support has given me a lot more confidence in taking care of patients in the emergency department. It has helped me be a great team leader and develop my team so that we work together in a very comfortable way.
Probably the best program I've ever been involved in. I've been involved in just about all of them.